Hi, I'm Dr. Will Gibbs, and this is Good Medicine. Have you ever had pain and used Motrin or Relieve? Well, here is some food for thought about those over-the-counter and prescription medications. Users of these medications, sometimes known as non-steroidal anti-inflammatory medications, or NSAIDs, are at increased risk of venous thromboembolism, better known as blood clots, according to a new study published in the Journal of Rheumatology. Some previous studies have linked the use of these drugs with increased risk of blood clots. This is the first systematic review of its kind assessing the risk. They found that NSAID users had an overall 1.8-fold increased risk of blood clots compared to the study participants who didn't use the drugs. Non-steroidal anti-inflammatory drugs relieve pain and reduce inflammation. Millions of Americans take NSAIDs for musculoskeletal problems, sprains, strains, back pain, headache, painful menstruation periods, as well as chronic conditions such as arthritis and lupus. These drugs can also cause stomach problems like bleeding, ulcers, and stomach upset. These class of drugs, which include aspirin, Advil, Motrin, Aleve, and Celebrex, are known to be associated with high blood pressure, swelling around the lower legs, feet, ankles, hands, and kidney problems. Heart problems and rashes are also not uncommon. There are safer things to do to help yourself at home to help acute pain. An old standby is rice. No, not that kind of rice. RICE, which stands for rest, ice, compression, and elevation. So taking 2 pills and calling in the morning may not be the best advice after all. I'm Dr. Will Gibbs, and you just got a dose of good medicine.